Unlocking Implementation Research, Bridging Science and Practice. Welcome to today's video. If you're a medical or health researcher, you've likely encountered a common challenge: translating research findings into real-world practice. How do we ensure that the brilliant interventions and innovations we develop in research actually make it to the people who need them? This is where implementation research comes in. Today, we're going to unlock the potential of implementation research and explore how it bridges the gap between science and practice. So, what exactly is implementation research? Simply put, it's the study of methods and strategies to promote the uptake of research findings into routine healthcare practice. It's about understanding how and why interventions work in real-world settings. Unlike traditional research, which focuses on discovering new treatments or interventions, implementation research aims to identify the best ways to implement these solutions effectively and sustainably. This field is essential because it's not enough to create evidence-based solutions. We need to ensure that these solutions are accessible, equitable, and sustainable in diverse healthcare environments. To really dive into implementation research, we need to get familiar with some key concepts. 1. Fidelity. This refers to the extent to which an intervention is delivered as intended. Are we following the protocol? If not, why? 2. Adaptation. In the real world, interventions often need to be adapted to fit different contexts. How do we maintain effectiveness while making these changes? 3. Sustainability. Finally, how can we ensure that the intervention continues to work over time, even after the initial implementation phase? These concepts are central to understanding how to bridge the gap between research and practice. Without them, even the most evidence-based intervention might fail in the real world. Now, you might be wondering, why does this matter for you as a health researcher? Well, think about it. What good is groundbreaking research if it never reaches the people it's supposed to help? Implementation research ensures that the impact of your work extends beyond publications and conference presentations. It empowers you to make a real difference in patient outcomes, public health, and healthcare systems. By incorporating implementation research into your work, you contribute to the science of how interventions are adopted, scaled, and sustained. And that's where real-world change happens. Okay, so how do you get started with implementation research? Here are a few steps. 1. Identify the intervention. What are you trying to implement? This could be a new treatment, a public health campaign, or a technology solution. 2. Understand the context. Who are the stakeholders? What are the barriers and facilitators in the setting where you want to implement your intervention? 3. Choose a framework. Implementation research is guided by frameworks that help structure your approach. Some popular ones include the Consolidated Framework for Implementation Research, CFIR, and the REAM framework. 4. Measure outcomes. Finally, don't forget to evaluate the implementation process itself. How well was it delivered, and what was the impact? Getting started with implementation research might seem daunting, but with the right tools and mindset, it can become an integral part of your research journey. In conclusion, implementation research is all about bridging the gap between research and practice. It's the key to ensuring that your work as a health researcher leads to real, lasting change in the world. If you haven't yet considered incorporating implementation research into your work, now's the time to start. Dive in, explore the frameworks, and most importantly, keep asking, how can I make a difference with my research? Thanks for watching. If you found this video helpful, make sure to subscribe for more content on implementation research, epidemiology, and everything in between. Let's continue unlocking the potential of research together. See you next time.